Gentlemen, I have given you, in your capacity of trustees, 13 acres of land, situated in the city of Baltimore and bounded by Wolfe, Monument, Broadway, and Jefferson Streets, upon which I desire you to erect a hospital.
With those instructions and a generous endowment from Johns Hopkins, the wealthy Baltimore merchant, the Johns Hopkins Hospital was established. Funds to establish the Johns Hopkins University, which is now located on the Homewood campus, were provided by the same endowment. Mr. Hopkins also wished that a medical school be incorporated, which would link the hospital and the university. In 1889, another Baltimore entrepreneur, Mary Garrett, and 4 of her friends raised $500,000 to build the new medical school, with the provision that women be admitted and would receive the same rigorous medical training as men. Johns Hopkins made his wishes clear. The university at Homewood would promote education, and the hospital would serve all who needed its services, regardless of their ability to pay. The hospital, medical school, and the university comprise the original core of Johns Hopkins, but Hopkins has grown to include a number of other institutions. The Bloomberg School of Public Health and the School of Nursing are located near the hospital and medical school in what is known as the East Baltimore campus. The David M. Rubenstein Child Health Building, the Harry and Jeanette Weinberg Building, the Wilmer Eye Institute, the Charlotte R. Bloomberg Children's Center, and the Sheikh Zayed Tower are now some of the newest buildings constructed on the East Baltimore campus. The Johns Hopkins Health System is made up of a number of Baltimore area hospitals and outpatient facilities who have joined with Hopkins. They include the Johns Hopkins Bayview Medical Center, Howard County General, the Hopkins Community Physicians, Sibley Memorial Hospital, Suburban Hospital, and Johns Hopkins at Green Springs Station, and All Children's Hospital in St. Petersburg, Florida. You are becoming a part of the Johns Hopkins healthcare team by giving of your time and of yourself. The spirit of generosity and love of mankind, which founded and nourished these Johns Hopkins institutions for more than 100 years, is the same spirit that you bring as volunteers. As volunteers, we hope you'll join us in fulfilling the mission of the hospital, which is setting the standard of excellence in patient care. We want you to understand your role as part of the team dedicated to providing the finest medical care. Volunteer services began at Hopkins with the formation of the Women's Board in 1925. The Office of Volunteer Services was formally created in 1959 to manage volunteers and to promote community understanding of the hospital's needs and services. Today, Volunteer Services carries on this mission. Each year, more than 1,000 individuals volunteer to enhance the services provided by the staff of Johns Hopkins. Volunteers help demonstrate service excellence and extend the best patient care possible in a patient and family-centered environment. Assignments are made based on each volunteer's skills and interests and the availability of volunteer positions. The assignments are varied and range from greeting patients, comforting and assisting patients and families. Others assist in supporting patients. Some volunteers conduct tours of historic sites on the East Baltimore campus and provide goodwill to visitors and guests. Volunteers work in both the children's and adult patient resource centers. They assist staff in the Child Life Department playrooms. Volunteers assist with holding infants in the NICU. Some volunteers are assigned to nursing units to visit patients and families or to run errands. Volunteers assigned to various clinical departments provide support and information to families and assist the staff. And various hospital offices have volunteers who help with clerical duties. These houses provide lodging for out-of-town families who are visiting cancer patients at Hopkins and for outpatients who are receiving treatment here. Each year, students from area high schools volunteer for special assignments at Hopkins as part of their academic programs. These students assist nursing and administrative staff and in turn receive first-hand experience in a possible future career. During the summer, area high school students also participate in the Junior Volunteer Program after a competitive selection and placement process. Individuals with special needs learn life skills and gain valuable job experience while volunteering at Johns Hopkins. Everyone benefits from this volunteer relationship. As part of the Hopkins healthcare team, you will make a big difference for the patients and their families. That's why it's important that you make a commitment to the part you will play at Johns Hopkins by following the volunteer services policies and procedures. We ask that you volunteer at least 4 hours per week, and that you sign in and sign out at the beginning and end of your shift. We ask that you wear your Hopkins identification badge while you're on campus, dress professionally, and follow the approved standards for your department. Before starting as a volunteer, you must complete orientation and have a screening for tuberculosis, which Hopkins will provide free of charge. Each year, it's mandatory to complete a review of important patient care and safety information. Reliability is very important. Please call your supervisor in advance if you are unable to report when you're scheduled. And please notify us if for some reason you find that you cannot continue your volunteer service. And always remember that patient confidentiality and privacy laws, known as HIPAA, are essential to any assignment you'll be asked to do. Please let us know if you have any problems with your duties. We want you to enjoy volunteering at Hopkins. And to help you enjoy the commitment you're making, we offer benefits that we hope you'll use. Hospital volunteers who work for a shift of 4 hours or more have the option of picking up either a free parking sticker for use in specific Hopkins garages, MTA tokens, or a meal ticket that can be used toward a purchase at one of the many eateries on campus. You can use the Hopkins shuttle for transportation at no cost. Use of the Patient Resource Center is also available to you. You're invited to enjoy free admission to special concerts, films, dance performances, and lectures that are held at various locations on the East Baltimore campus. We're delighted to recognize you for your contribution to Hopkins during the annual Volunteer Celebration in the spring. As you begin your assignment, please remember that as hospital volunteers, you are special people in a special situation. Recognize that each patient you meet has been placed in a new and probably frightening situation, and that you can affect patient care, for better or worse, by your attitude and actions. Make a special effort to keep all information concerning patients and staff absolutely confidential, whether in or out of the hospital. Approach each assignment with friendliness and courtesy. Refer any problems or concerns, no matter how routine, to an appropriate staff person for action. Remember, you are part of our team. Communicate with your supervisor and the Department of Volunteer Services staff to assure that your needs and ours are met. Whether you're holding the hand of a young child, providing support for a newly diagnosed cancer patient, or are involved in any of the hundreds of volunteer positions, you are helping to make a big difference, and you are a gift to Hopkins.